Hi, I'm Sneh Wadwani. I'm a women's health GP practicing from Bondi Junction in Sydney, and I'm also the National Clinical Director for Evoca Women's Health, a network of 35 clinics across the country dedicated to delivering and empowering the best in women's health. Today's day 3 of Women's Health Week, and today we're talking about empowering women to speak the unspoken. We know that through a woman's life, they will experience a variety of changes and transitions, which in itself will bring different symptoms and problems along the way. Whilst many of these are simple and straightforward and can be addressed, there are still barriers to women seeking help for certain problems which they believe are embarrassing, they might perceive there to be stigma around, and may be poorly misunderstood. In this space, we see that women can often suffer symptoms that will worsen and also significantly affect their daily life and ability to function. We're going to go through a few examples of these on this video. The first one that I want to talk about is urinary incontinence. Urinary incontinence can affect up to 1 in 5 women of any age, and starkly, up to 1 in 3 women who've had a baby, regardless of how that baby has been delivered. So that's a significant proportion of women affected by these symptoms. Whether it's incontinence when you cough, sneeze, jump, or run, or whether it's incontinence when you have sex or when you orgasm. It can even be an increased frequency of needing to pass urine, such that it affects your daily life, your ability to work, and even your sleep. Now, many women will try to manage this themselves by restricting their fluid intake, which in turn has its own health problems. But actually, we know in women that this is a common condition and often is underrepresented and often not treated. You can speak to your doctor about this and know with confidence that there's lots of things we can do to help, whether it's pelvic floor exercises or medication to calm down the contractility of the bladder, or even assess for things like prolapse. There's many things that we can do to assist in improving your symptom profile. The second condition I want to talk about is heavy menstrual bleeding. For many of us, we've grown up at a time where pain or heaviness of menstrual loss is just to be accepted as part of being a woman. Up to 1 in 4 women experience heavy menstrual bleeding, and that's bleeding that is more significant and more troublesome, that allows them to get on with their normal life. So we don't quantify what that blood loss is, but if it matters to you and it's a problem to you, it's a problem for us to solve. There are often common causes of heavy menstrual bleeding, whether it be fibroids or even adenomyosis. However, they can all be addressed, whether it's with a device that will also provide you with contraception, such as the intrauterine system, or whether it's medication to just reduce the flow at the time that you bleed, or whether it's managing heavy menstrual bleeding in the perimenopause. These are all things that we can address, but they're so important to do so. Aside from causing their own problems with managing the menstrual flow, these symptoms also cause knock-on effects with things like iron deficiency anemia. And that can cause symptoms of chronic fatigue and inability to do your activities of daily living. A third condition I want to talk about today is pain with intercourse, or pain in the vagina. This is a very common condition, very common symptom, but is not normal. It's not normal for any woman to experience pain with intercourse or pain in the vagina. And in that sense, it needs to be addressed with your doctor. There are a variety of reasons why these symptoms may occur. Whether it's because the pelvic floor muscles are particularly tight or in spasm, or whether there's a chronic condition of the vagina leading to discomfort or inflammation in the vaginal tissue, such as a vaginitis for any particular cause, it still needs to be addressed, and we can still improve things for you. Unfortunately, when pain during intercourse or pain in the vagina continues, it leads to a negative feedback mechanism whereby the muscles of the pelvic floor and the body itself sensitizes to pain and tenses up in anticipation of activities or situations which may provoke pain. Know that there's plenty of things we can do to help, whether that's topical preparations in the vagina itself, or pelvic floor physiotherapy, or even medication to calm down a nerve response in this space. We can help. The final condition that I want to talk about today is sexually transmitted infections. There's still a huge taboo around presenting with sexually transmitted infections or the symptoms of these. The reality is sexually transmitted infections are extremely common. And even with the best use of condoms, sometimes we can still acquire sexually transmitted infections in this way. In most situations, sexually transmitted infections can be treated really effectively as long as they're done so promptly. And in this scenario, most women won't suffer any ongoing effects. Your doctor is here to treat you in a non-judgmental way, to assess your risk and help you manage that in the best way possible for you. So whilst all of these topics can sometimes bring a sense of shame, embarrassment, a perception of stigma, please know on the other side of that consultation desk, you're being received without judgment. You're being received by a clinician who cares and wants to help you. Celebrate Women's Health Week this year by embracing and empowering your women's health journey today. If you don't have a regular women's health doctor who can help you focus on your women's health, then book an appointment today in one of our Evoca clinics with one of our experienced and skilled and passionate practitioners in the space. Happy Women's Health Day.